This is regarding what? Capnography. Now coming to the other types of endotracheal tube. The endotracheal tube that you see on your screen, it is what tube, guys? This is called as flexometallic or armored tube. This is called as what, guys? Flexometallic or armored tube. But before going towards it, again I'll give you a case. Again I'll give you a case so that we can understand for what surgery we use this endotracheal tube. Recently, one of my friend was being diagnosed with severe cervical spondylosis. Surgeon told that surgery is required for severe cervical spondylosis. He told that he will do some surgery. He'll fix the vertebrae and all. So he was happy that surgery needs to be done and all. And I was the anesthetist for his surgery. So look over here, guys, what I did, I remember, first of all, for cervical spondylosis, the surgery has to be done on this area. Which anesthesia needs to be given to the patient? What is the anesthesia that needs to be given to the patient? Come on, it is general anesthesia. It is above umbilicus, so you have to go for general anesthesia. So I have also planned for general anesthesia for my friend. So I gave general anesthesia. Again, general anesthesia is given in 4 phases. The first phase is pre-oxygenation. Second is induction. Third, maintenance. Fourth, reversal. First is pre-oxygenation. I gave oxygen to the patient. I gave some oxygen to the patient. I have given some pre-oxygenation. I have given some oxygen to the patient. After giving oxygen, I went into the induction phase. In the induction phase, what should be my aim, guys? In the induction phase, what should be my aim? The first aim in the induction phase should be what? I should make the patient unconscious. The second aim should be what? I should make the muscles relax. The third aim should be what? I should ventilate the patient. I should intubate and ventilate the patient. So I made my friend unconscious by using propofol. Then I gave shortest acting muscle relaxant, that is choline. Okay, after giving choline, first he had fasciculation, then 30 seconds के बाद no fasciculation, then I intubated. After intubation, okay, next I went into the maintenance phase. But the surgeon, he told, now I will start the surgery. Normally surgeon starts the surgery in the maintenance phase. Okay, in the maintenance phase we'll hand over the patient to the surgeon. So I went into the maintenance phase and the surgeon told, I will start the surgery. I told the surgeon, go ahead with the surgery. Surgeon told, I have to do the surgery over here. Patient is in the supine position. Make the patient lie down and prone, then only I'll be able to do the surgery. So what they did, they made the patient lie down in prone position. Prone position. If you intubate the person with a normal PVC tube and make the patient lie down in prone position, there are many chances that your tube might bend and it might kink. It might bend and it might kink. If there is kinking of the tube, it will be obstruction of the tube and you won't be able to ventilate, right? So remember, you can't use PVC tube for prone position surgeries. For prone position surgeries, we use this tube called as PVC tube. I had used this, in prone position surgeries, we use this tube called as flexometallic or armored tube. I have used this flexometallic tube for my friend, and when the surgeon told he wants the prone position, we make the patient lie down in prone position. Even though you keep in any position, this flexometallic, even though you try to bend it, it won't kink, it won't obstruct. Why? Because in the flexometallic, there is a metallic component that prevents the kinking of the tube, right? So, flexometallic or armored tube. We are talking about what, guys? Flexometallic or armored tube, right? This flexometallic or armored tube is used for what? Flexometallic or armored tube, it's used for surgeries requiring the patient to be in what position? To be in prone position. Prone position, right? Flexometallic. Why? Because no matter how much you bend, will it kink? It won't kink. Flexometallic or armored tube, no matter how much you bend, It won't kink. It is used for the surgeries that are requiring the patient to be in what position? Prone position. That's regarding what tube? That's regarding the flexometallic or armored tube. That's regarding the flexometallic or armored tube. Next form of endotracheal tube is called as raised tube. Next is called as raised tube. What is this raised tube? It is ring Adair Elvin tube. It is a ring Adair Elvin tube. Ring Adair Elvin. Ring Adair Elvin. RAE full form is ring Adair Elvin. There are two kinds of raised tube. Okay? There are two kinds. One is the south facing, one is the north facing. First of all, guys, what is the importance of raised tube? For what surgery you will require to put a raised tube? Imagine, guys, you might have gone into the movie theater. Before starting a movie, they will be showing an ad of tobacco. I'm not taking anyone's name. You guys know the name of the person, right? Who usually they show in the movie theater in the ad. Imagine that person who is coming with oral cancer. He is having oral cavity cancer. Tongue is carcinomatous. Cheek is also carcinomatous. He is going towards the surgeon and he is telling the surgeon that, "Doctor, I am having cancer. Please, will you remove it?" The surgeon will tell, "Okay, I will remove the cancer." He is calling you. You are the anesthetist. The surgeon is calling you and telling that there is a cancer patient. We have to do I will remove his tongue. I will remove his cheek. The surgeon is telling, I will remove his tongue and cheek. He will be asking us, what anesthesia will you give for the removal of this cancer? Come on, guys. It's a oral cavity above umbilicus, major surgery. You have to go for general anesthesia. You will tell me general anesthesia. I will tell you what? Okay, go for general anesthesia, but don't put the endotracheal tube orally. Why? Because if you put the endotracheal tube orally, I won't be able to do the surgery. Right? Why? Because during surgery, there will be many chances that I will damage the tube also. So, he will tell what? Don't put the tube orally. Put the tube nasally. The endotracheal tube that can be passed through the nasal cavity into the trachea is called as what? Nasotracheal tube. It is a nasotracheal tube. And what is a nasotracheal tube are we talking about? That tube is called as raised tube. Ring Adair Elvin tube. It is used for what? Ring Adair Elvin tube is used for oral cavity surgeries. Oral cavity surgeries. Oral cavity surgeries such as oral cancer or cleft surgeries. Oral cancer or cleft surgeries. These are the most unhygienic tubes. These are the most unhygienic tubes. Why, sir? Why these are the most unhygienic? Why? Because you are passing the tube through the nasal cavity. Nose is the unhygienic thing. So you can take that organism into the patient's trachea, right? So these are the most unhygienic tubes. That is called as raised tube. Okay. The next tube that we need to discuss is about the DLT. DLT is a double lumen tube. For what surgeries will you use this double lumen tube? Again, we'll go with an example to understand this. Imagine there is a patient who is being diagnosed with right lung cancer. Who's being diagnosed with right lung cancer. And this patient comes to the surgeon. Surgeon is telling that I will remove the cancer. The cancer is benign and I'll remove that cancer. Surgeon is asking the anesthetist, what anesthesia will you give to this patient? Come on, guys, what anesthesia should we give to this patient who is diagnosed with lung cancer? What anesthesia should we give? General anesthesia we have to give. We have to give general anesthesia. Surgeon is telling, give him general anesthesia or give him any anesthesia, that's not my concern. If you give him general anesthesia, do not ventilate his right lung. Only ventilate his left lung. Is it possible, guys? Is it possible for one lung ventilation? Yes or no? Yes. One lung ventilation is possible and you can easily maintain the saturation with one lung also. But is it possible with a normal endotracheal tube? Is it possible for a normal with a normal endotracheal tube that you maintain one lung ventilation? No. Why? Because if you use a normal endotracheal tube, it will be positioned above the carina and both the lungs will be ventilated. Yes or no? So you can't take a normal endotracheal tube. You shouldn't take a normal endotracheal tube, right? For a patient who is posted for surgery under one lung ventilation or surgery of the lung, you have to place a long tube which is called as double lumen tube, right? Double lumen tube is a long tube where you go for endobronchial intubation of the left lung. Okay? As we are taking an example of right lung cancer, we have to go for endobronchial intubation of left lung. Yani you introduce the tube into the trachea and from there you introduce the tube into the left bronchus and then you fix it. Okay? So then you fix it. So one cuff will be over here and one cuff will be over here. Both the cuffs you have to inflate. One is the tracheal lumen, other is the bronchial lumen in the double lumen tube. Okay? Both the cuffs should be inflated so that both should be positioned normally both the cuffs should be inflated, guys. Whether it is the bronchial or the tracheal. After introducing the tube, first fix the bronchial lumen by inflating the bronchial cuff. Then fix the tracheal lumen by inflating the tracheal cuff. So that the tube is totally fixed. It doesn't move from its position. How will you determine the correct placement of the double lumen tube? Double lumen tube placement can be determined by, now don't tell me capnography. Capnography is used for endotracheal tube. Double lumen tube placement can be confirmed by fiber optic bronchoscope. So guys, double lumen tube we are discussing. Double lumen tube, what is the indication of double lumen tube? What is the indication of double lumen tube, guys? It is indicated for surgeries requiring one lung ventilation. Surgeries requiring one lung ventilation. It could be lung decortication surgery, or it could be any lobectomy or anything. You can go for double lumen tube placement. The exact position of double lumen tube can be confirmed by what? The positioning of DLT can be confirmed by fiber optic bronchoscope. Fiber optic bronchoscopy. Okay? Positioning of the double lumen tube can be confirmed by fiber optic bronchoscopy. That was regarding the double lumen tube. Next is what, guys? Next airway device which is available on your screen is called as Ambu Bag. Ambu Bag. What is the full form of Ambu? The full form of Ambu is Artificial Manual Breathing Unit. Right? With this Ambu Bag, you can deliver 100% of oxygen. Right? This Ambu Bag is having a unidirectional valve that prevents rebreathing. What is that unidirectional valve called as? That valve is called as Rubin's valve. That is called as what valve? Rubin's valve. There are three, just look over here, guys. There are three sizes of Ambu depending upon the volume of Ambu totally depends on for what person are we using. If you are using Ambu Bag for adults, the bag size will be a bit huge or a bit big when you compare it to the neonates and infants. So remember, guys, the volume of Ambu in adults, it is 1 to 2 liters, whereas in pediatrics, as they are having low tidal volume, 500 ml, whereas in neonates, as they are having very low tidal volume, we use 240 ml. Right? On the Ambu Bag, we are having unidirectional valve that prevents rebreathing. What is that valve? Rubin's valve. And with Ambu, 100% of oxygen will be delivered. For adults, what is the size? 1 to 2 liters. For children, 500 ml. Whereas for neonates, less than 1 month old child, we have to use a 240 ml Ambu, right? That was Ambu Bag. Next, coming to this device which is called as face mask. Face mask. Face mask is the device that provides a seal for ventilation. If you haven't put the endotracheal tube, you can connect the breathing circuit to a face mask. This face mask is made up of anti-static rubber. What is meant by anti-static, guys? First of all, face mask is used to provide positive pressure ventilation, which is made up of anti-static rubber. Anti-static meaning what? Shock-proof and fire-proof. Shock-proof and fire-proof. Meaning what? If there is any shock-like incident or fire-like incident happening in the operation theatre, it won't be transmitted to the patient. Why? Because the face mask is made up of shock-proof and fire-proof rubber. Coming to the last airway device, which is called as Guedel's Oropharyngeal Airway. Now this Guedel's Oropharyngeal Airway, or airway device is used for what patients? Remember, this airway device can be used in the emergency room as well as the operation theatre. In the emergency room, when a patient is in seizures, you take this airway and keep it in the patient's mouth so that the patient should not have a tongue bite. Why? Because during seizure or fit-like episode, the most commonly damaged structure in the mouth is what? Tongue. So to prevent that tongue bite, we put this Guedel's Oropharyngeal Airway. In the operation theatre, if a patient is very much obese after giving general anesthesia, you can put this airway device into the patient's mouth. What will it do? It will basically prevent the back falling of the tongue, right? Remember, guys, Guedel's Oropharyngeal Airway can be used for preventing the back falling or preventing the tongue bite, right? What size Guedel's Oropharyngeal Airway we have to use? The correct size is determined by keeping the airway device between the tragus of ear and angle of mouth. If it is fitting into that area, that airway device we have to use. So remember, guys, Guedel's Oropharyngeal Airway is used to prevent the fall of the tongue during anesthesia and also prevent tongue bite during seizure episode. During seizure episode. How is the correct size determined? The exact size of the airway can be determined by keeping the airway between the tragus of ear and angle of mouth. Between the tragus of ear and angle of mouth. So this was regarding the Guedel's Oropharyngeal Airway. Okay, guys? Thank you.